Good day, doctors. I'm Dr. Derrick Cabais of Jose R. Reyes Memorial Medical Center, and under the guidance of my advisor, Dr. John Hubert Pua, here to present a study titled Volar plating versus conservative treatment of a complex intra-articular distal reduced fracture in the elderly, a meta-analysis. This is the outline of my presentation. Distal reduced fracture are the most common fractures of the upper extremity and second most common fractured bone in elderly, with a bimodal distribution. The incidence rate is 200 per 100,000 individuals. And there are numerous surgical and conservative treatment options for the management of distal reduced fractures, but regardless of the treatment modality, the goals of care are to restore function and improve pain in hand and wrist. Controversy remains as to whether distal reduced fracture in elderly should be treated surgically or conservatively. Non-operative management still remains the mainstay of treatment among elderly. However, in recent years, there have been trends to treat distal reduced fracture patient with a volar locking plate. At present, there is no clear answer to whether in a complex intra-articular fracture would benefit from anatomical reconstruction. The objective of the study is to compare the outcome of open reduction and internal fixation with volar locking plate, or closed reduction and plaster immobilization of complex intra-articular distal reduced fracture in elderly patients. Comprehensive literature search were conducted using online database. This study included RCTs and cohort studies in patients 60 years old and older with a complex intra-articular distal reduced fracture treated with ORIT via volar locking plate or casting. Reported outcomes include wrist function using DAS score as primary outcome and wrist pain using the visual analog scale, wrist range of motion, and grip strength as secondary outcome. Out of 10 retrieved articles, 6 were included in the study, including 4 RCTs and 2 retrospective studies. The studies were published between 2011 to 2020. 6 studies with a total of 605 patients were included. 291 were in the volar locking plate group, and 314 were in the conservative management group. All patients aged 60 years or older were included in all studies. 5 studies provide data on the DAS score of 505 patients. Analysis of the pooled DAS score data revealed a significant difference between plating and conservative treatment, favoring the volar locking plate over the conservative treatment. For the secondary outcomes, visual analog scale scores favored conservative treatment against volar locking plate and final follow-up, but no significant difference was identified. There's an improved grip strength with a significantly having a higher percentage value in patients receiving volar plating versus those managed with conservative treatment. Wrist range of motion showed no significant difference between the volar and the conservatively treated patients. This meta-analysis evaluated the functional outcome after volar plating versus casting of a complex intra-articular distal reduced fracture among elderly. And the main findings were, there's a significant difference in DAS score and grip strength favoring the volar plating, but no significant difference in the VAS score and wrist range of motion. This concludes that the result of this meta-analysis compared to other studies showed that the displaced complex intra-articular distal reduced fracture among patients 60 years old and older treated with volar locking plate provides better functional outcomes and a better grip strength compared with conservative treatment. Results showed that elderly patients with a complex distal reduced fracture will benefit from the volar locking plate, but indications for operative fixation should be carefully assessed in the treatment of elderly patients. These are my references. Thank you. Have a good day.